My name is Desmond Jenson. I'm the lead senior staff attorney for federal regulation here at the Public Health Law Center. And our guest today needs essentially no introduction. Dr. Brian King, you know him from everywhere you've been in tobacco control for the last decade, formerly at the CDC, brilliant scientist, engaging speaker, fantastic tobacco control advocate, great human being, all around nice guy. My friend and yours, Dr. Brian King. Brian, it is awesome to welcome you to our webinar. I'm thrilled. The format today, Brian's going to give a sort of a short presentation, sort of overlaying what's going on at CTP and some of the things that they're thinking about there. And then we're just going to have a conversation. And we all have lots of questions for Brian, so feel free to drop them into the Q&A of Zoom right now, and we will do our best to have a full hour of all of the questions. I'm sure we won't get to all of them, but we will ask Brian anything and everything that we want to know. So to start, I will turn it over to you, Brian.
Excellent. Thanks, Desmond. A marvelous introduction. It's all true, folks. I appreciate it. And I've been called far worse, so I'm glad we're starting on a good note. It can only go down from here. I appreciate the opportunity to chat with you all. As I'm sure you're all aware, I'm about 4 months in to my new role as the director of the Center for Tobacco Products. Sometimes it seems like inordinately longer than that, but I've certainly hit the ground sprinting in many respects. I do think that we've got great opportunities moving forward. As many of you all know, I've obviously been in tobacco control for many years, and I left within the past couple years. I'm working on various emergency responses, including COVID-19. And when this opportunity rose up, I thought it was a great time to get back into the field. And the reason I did is because I think we have some really great opportunities. We're really at the precipice of a critical period in tobacco control. And I'm hopeful that I can serve a really critical role in helping to move that needle in a very meaningful way. So today I'm going to walk through a series of slides just to wet your whistle a bit and get us all on the same platform in terms of where the center is and where we're going. Thereafter, we'll then open it up for Q&A. I will say that I'm not a big fan of canned questions. And so you've got your forewarning, 15, 20 minutes, prep those questions and then fire away and look forward to hopefully some fruitful discussion with our Phil Donahue in residence, the one, the only Desmond Jenson. So without further ado, some updates from CTP. Before I'm getting into the specific programmatic work, I did want to just talk through some of my priorities. This is one of the most common questions I get, aside from why in the heck would you want this job? The second question that follows thereafter is what is most critical to you. And so these are the 4 thematic areas that make me tick on a daily basis. Not necessarily what keeps me up at night, but what gets me to wake up in the morning. And these are going to be at the crux of my leadership and my drive and my decision-making at CTP. The first is sound science. Of course, I'm a scientist by training. I'm actually the first scientist to hold this position. The first was a clinician, the second was a lawyer, and now they have a scientist. I'm sure there's a funny joke about the 3 of us walking into a bar somewhere, but for my part, I'm happy to serve in this role. And obviously, given my background, I will be continuing to drive the science at the forefront of all our decision making. The second is partnerships. Those who have worked with me in the past know that engagement and stakeholder relations is a key component of my work. It's been my bread and butter for many years. And I think that this is critical to continue moving forward. And it's not one-sided partnerships. I do think it's important to talk to everyone. And that includes stakeholders across the spectrum, from public health to retailers to industry. Everyone has a role. And FDA is responsible for regulating the marketplace with an important public health lens. But we do have a responsibility to ensure that we are listening and hearing from everyone. And I'm committed to doing that. And towards that end, I've had upwards of 20 meetings already since I started and look forward to more. The third is communication. As many of you know, this has also been a bread and butter of my career. I served in the Deputy Director for Research Translation role and for many years at CDC in the Office on Smoking and Health, and for lack of a better analogy, was the mouthpiece of CDC on tobacco. And I think communication is very key. And I think it's important, particularly in the government, that we have black box communication where we tell people what's happening, what we plan to do, and then we wait until the end when we're ready to roll it out. And there's this black box in between where a lot of people don't hear anything happening and they interpret that as nothing is happening. And that couldn't be further from the truth. And so for my part, I'm committed to continuing to communicate as readily and easily as possible to make sure we're keeping people informed across that continuum. But also that we're making sure that the message is getting to people in a digestible way that they can understand and it's relevant. We're delivering it to the right people at the right time, but also via the right mechanisms. And so for that part, I'm fully on board with ensuring that we can continue to communicate and be as transparent as possible. And the last priority for me is health equity. I will say that this is something I think we've been wholly deficient on as a broader community in general over the years. And we're at the precipice of a really important time where it can be front and center. We have a Surgeon General's report in the queue on disparities, and we've seen a lot of great momentum towards that. And I'm really committed to putting this front and center in CTP's programmatic portfolio. As many of you are aware, I have created a new position as Senior Advisor for Health Equity that we're currently hiring for. And it closes on the 16th. And I'm hopeful we'll get strong applicants, and the first role of that person will be to develop a strategic plan for programmatic work for CTP on health equity. We've done a lot of great work in terms of workforce health equity, but we've got a lot more potential when it comes to programmatic. We've certainly done some really great work that I'll talk about later, particularly related to health comms and campaigns, but there's always more to do. And I think now is better than ever, particularly given the product standards we've got in the queue. So with that, I'm going to go into the main talk for the next 15 minutes or so and walk through the four programmatic key areas for me in terms of where we're focusing the bulk of our energy at CTP. The first is rules and guidances, particularly product standards. The second is application review. Third is compliance and enforcement. And then the fourth is public education. And so without further ado, I'll walk in on rules and guidances. As many of you are aware, one of the greatest authorities that was afforded to the FDA and the Tobacco Control Act was the ability to implement product standards. We have not implemented any to date, but we have some that are very close in the queue, and that includes the proposed standards to prohibit menthol in cigarettes and also prohibit flavors in all cigars. Those were announced in April 2022, so earlier this year. There was a public comment period. We received upwards of 250,000 comments. We were also trending on OMB's website at one time. I'm still not sure if that's a good or bad thing, but I'm going to chalk it up as the former because people were engaged and they were interested. And so in terms of next steps, we're reviewing all of the comments. And after that, we make a decision on where we go with the rulemaking. And so that can include continuing to a final proposed rule, making changes before doing so, or also rescinding the rule altogether. That said, I'm hopeful that we'll be able to continue that rulemaking as quickly and expeditiously as possible. But we do want to review every one of those comments and make sure that they are incorporated into those final rules. I can't share a crystal ball of when we intend to have this done, but I can assure you it's a key priority of mine. To make sure that we keep the rulemaking moving as expeditiously as possible. In addition to those two, we also have another really novel product standard that we've announced we intend to propose, and that is to establish a maximum nicotine level in cigarettes and on certain other combustible tobacco products. This is a real game changer. Some of you have been in the field for very long. I remember even in the 90s when this first was proposed, it was dubbed an endgame strategy, and it's been noted in multiple Surgeon General's reports. It was only a twinkle in the eye, and now it's close to being a reality. And it has a profound impact in terms of not only preventing initiation, but also promoting cessation and addressing the component of these products, which is the highly addictive agent of nicotine. And so we intend to propose the rule. Again, no crystal ball of when this is going to happen, but I will say that it's a high priority of ours to keep these moving. And ultimately, I think that these product standards as individually, but also as a whole, have a profound potential impact on the burden of death and disease from tobacco use in this country, and also have a very important health equity component. And the menthol is a prime example of that, not only by race and ethnicity for African Americans who have disproportionately higher levels of menthol smoking, but also the LGBTQ plus population, those with lower socioeconomic status, and also those with behavioral health conditions, among several others. We have a profound opportunity here, and I want to make sure that we get it right. And as we continue to proceed forward with the rulemaking, we're also coordinating and working with partners to ensure that we're addressing key factors with the release of the potential rules, including around cessation resources and also addressing the important social justice issue. Although the menthol and flavored cigar would not have an individual enforcement provision where it would be illegal to have individual possession or use, it is important to consider implications particularly related to state and local action. And so we want to make sure that we educate people, we ensure that any misperceptions are addressed, and that we're in a solid place based on the evidence and awareness to keep things moving. So with that, I'll move to applications. This is an area that gets a lot of attention at CTP. As many of you are aware, we got a large bolus, we're calling it, of applications at FDA with e-cigarettes based on the September 2020 deadline. We got upwards of 6.7 million applications for these products. I'm sure folks do know the process that we're required the manufacturers are required to submit an application for their product, and then the FDA is responsible for reviewing those. To date, FDA has reviewed 99% of those applications. And a result of those, we've issued 23 authorizations for e-cigarettes, all non-flavored varieties, so tobacco varieties. And we have issued negative orders on millions of those other products. We still have the 1% to get through. We're hoping to get through those by next year, the middle of next year, and it's a priority of ours to make that happen. I will say that in terms of the question that always comes up is what's taking so long? And the answer to that is think of it as when you're pruning a tree, and the lower hanging branches are a lot easier to get at and they don't take as much time. And as you move forward in the process, the ones that take longer are the ones that are further on in terms of the length of the review, the amount of review, and the various considerations. So they're going to take a bit longer, but we are committed to moving through those and have had several announcements related to various products within the past few weeks alone that are getting us closer to completion of those. Here's just an example of some of the orders that have been granted or denied. Obviously, a marketing granting order is products that we have authorized. Reminder that FDA does not approve any tobacco products. All tobacco products carry risk, and there's no such thing as a safe tobacco product. But we do acknowledge that FDA is tasked with the role of authorizing these products. And to do so, we have to weigh the net benefits and risks at the population level. And Congress has given us a very important public health standard if something is appropriate for the protection of public health. And so when we're reviewing these applications, we have to weigh whether the potential benefits from adult smoker who may use the products to quit completely or to transition significantly in terms of reduction of amount of cigarette smoke, whether that outweighs the known risk among youth in terms of initiation and other vulnerable populations. So you see here, we've definitely authorized several based on that evidence, but also issued many marketing denial orders, as you've seen, including most recently the first menthol e-cigarette marketing denial order, which was for Logic just last week. We also recently had authority that was granted to us by Congress to regulate synthetic or non-tobacco nicotine products. We received 1 million additional applications because 6.7 million wasn't enough. We got another million. This was a closure of a very important loophole so that it put all manufacturers on the same playing field, but they still have to go through the same process that was outlined by law. Presently, we are working through these applications as well. One of my first days on the job, I did a back of the envelope calculation based on how many applications we had and how long people wanted us to do it. And it would have been 17,000 applications a day, working 24 hours, 7 days a week. So Herculean at best, impossible at worst. But given that volume, we certainly had to prioritize, and we have moved through those, and we're now 95% through. And I'm hopeful that we'll get through all 100% in terms of initial acceptance review by the end of this year. And then if they get through that, there's currently 1,600 that have made it through that first step. Those then go through a more nuanced review, which is filing review, when we do a full scientific evaluation of the content. So we're moving along on that front as well. And again, priority to get us to 100% for both that initial bolus as well as the synthetics as quickly as possible. Next priority area is compliance and enforcement. I will say that we have a variety of tools at our disposal. Here's a few examples, advisory actions such as warning letters. And this is something that FDA has used prolifically. I know some folks think, well, a warning letter, you're just sending a letter to people. What are they going to do? We actually find that these are quite effective. A majority of entities who are issued the warning letters do heed the information and requests that are made in the warning letter and take corrective action. And it also is a shot across the bow to others in the industry and manufacturers and retailers. And we do see shifts in terms of behavior by others as a result of public issuance of these warning letters. But we also have other tools in the toolkit, and those include regulatory enforcement actions, administrative actions such as civil money penalties, and also judicial actions such as seizure injunctions and criminal prosecution. So this is the latest in terms of the e-cigarette bolus of what we've issued. We've done over 290 warning letters. That represents over 17 million e-cigarette products for those who have not submitted a timely application. And that represents about 135 companies. And we continue to issue warning letters on nearly a daily basis, not necessarily just for e-cigarettes, but other products as well. And we're moving like gangbusters. Just to put it into context for you, the entire agency, FDA, issues about 400 warning letters a year, and that center is outside CTP, and the Center for Tobacco Products does 400 about a week. So we're moving in terms of volume, and same with civil money penalties against retailers. In terms of the amount we've released, it's about several thousand within the past year, and the rest of the agency is really zero during that time. So we're certainly set apart in terms of the productivity and work we're doing relative to our counterparts. But we also know that sometimes people don't want to comply or they don't choose to, and we do have other actions we can take. And so for the first time ever in the history of the center within the past month, we did coordinate with the Department of Justice to seek permanent injunctions against 6 e-cigarette manufacturers who, after repeated warnings and provided those warning letters, did not comply, continued to sell violative products. And so we worked with the Department of Justice and took them to court. If they were waiting for a personal invitation to comply, they got it in the form of a sign or sue letter from the Department of Justice. I will say that FDA does not have independent litigation authority, and that's a misperception by many. We are the U.S. government, so the Department of Justice are our lawyers. And so we do engage with DOJ in our decision-making around issuing of warning letters, as well as other enforcement actions, and we'll continue to do so moving forward. So in addition to the overall work around enforcement compliance, we also have started to issue actions related to the synthetic nicotine authorities. And that includes issuing our first warning letter for nicotine gummies. Those were synthetic products. And within a few hours of issuing the warning letter, the manufacturer took the products off of their website and no longer sells them. We also have prioritized work against brands that we know kids are using. And we did issue a warning letter to the most prominent synthetic e-cigarette brand, Puff Bar, only a few weeks ago, based on data from NYTS showing that it was the most commonly used brand among kids. And we continue to follow up with the company to ensure compliance with the statutes laid out in that enforcement letter. So now I'll transition to public education before we open it up to questions. As you all know, public health campaigns are a key component of tobacco prevention and control activities. In terms of best practices for comprehensive tobacco control programs, it's again been a component since '99 and all the way through in the most recent iteration. And for FDA's part, we continue to do the Real Cost campaign, which has found prevent hundreds of thousands of youth from starting to smoke, and also saving significant dollars in terms of preventing them from becoming adult smokers, but also reducing lost productivity costs. We will have the latest iteration of our Real Cost ads coming out in 2023. So we're excited about that and look forward to continued progress on this space, ensuring that we're not playing that game of public health whack-a-mole and we're reducing all forms of tobacco product use among kids, particularly those that are most prominently used. And in addition to that, we also want to keep a very important health equity lens. Towards that end, for the first time, we did release the Next Legends campaign, which was focused on youth, American Indian, Alaska Natives, specifically on e-cigarettes. It was a digital-only campaign, and it really focused on a marked disparity that we've seen for many years, and we're hopeful will be the beginning of much continued work in this space to ensure that we're addressing key populations, particularly youth and young adults, but also those with the greatest burden of use of products. In addition, we also continue to expand our print campaigns and work, and this is an example of some work we've done in coordination with our colleagues at the National Cancer Institute, with various ads focused on cessation and youth and young adult angles in particularly. And you can see very diverse, and we want to take an important health equity lens to the work we're doing and ensure we're reaching all audiences and not leaving anyone behind. So we're very proud of this work, and I am confident that it will continue in a very meaningful way. So with that, before I close my mouthpiece, I'm going to just summarize where we're at before we open it up to Q&A. In terms of our general approach under my leadership, we're going to remain committed to using our regulatory authorities to protect public health. FDA is part of the U.S. Department of Health and Human Services, and Congress gave us a charge related to the appropriate for protection of public health. And so no one better than a public health scientist to take that on. And I'm committed to ensuring that the science always drives our decision making and that we keep that important public health lens in all the work we do. Towards that end, we continue to issue proposed rules on menthol cigarettes and flavored cigars with that intent to propose a nicotine standard for combusted tobacco products. Huge potential here for impact on public health. Application reviews continue. We've got 99% down on the 6.7 million that came in by the September 2020 deadline, and we're 95% through the synthetic applications for the first acceptance review phase. Compliance and enforcement is a very important component of our work. We've got hundreds of warning letters to manufacturers and thousands to retailers for e-cigarette violations, but we've also ramped it up recently. And within the month, we've had unprecedented actions in terms of issuing injunctions in coordination with Department of Justice. And finally, we'd be remiss if we didn't continue education. And that is continuing to prevent youth use of tobacco product initiation through the real cost and also the new Next Legends campaign. I will say that we're also mindful of as well as the continued critique that we get around continuum of risk. FDA is certainly mindful of this, and we continue to explore scientific and evidence-based ways that we could mention on the continuum of risk, which certainly exists, but can't come at the expense of youth initiation. And so it's critical that any messages that we do relay are evidence-based and that they're targeted towards the key population for which this could benefit, which is adult smokers who transition completely or significantly reduce the amount they smoke. And we can't inadvertently introduce messages that could increase initiation among kids. So certainly on our radar, but the science is going to drive the decisions, and the formative work is critical when it comes to that type of messaging. So with that, I will just end with, if there's any questions that folks have, we have a variety of different opportunities to get in touch with us. I'm sorry to say that you will not reach me directly through any of these mechanisms, but you'll certainly find its way to me eventually. We do have a lot of opportunities where you can contact us in terms of reporting adverse experiences from tobacco products. This is really helpful for us to get key information for potential investigation, including compliance and enforcement actions, but you can also just submit standard questions or also follow us on Twitter. I will say that I am not on Twitter and I do not follow the comments that are being made. I choose to use my opposable thumbs in more productive ways. But by all means, we do have a presence, and if you'd like to engage with us there, by all means, feel free to do so. So with all that said, I'm happy to open it up to Q&A. So Desmond, take it away.
Thanks, Brian. I gotta say, it's gonna take some getting used to see your closing slide not have your infamous CDC email address on it. And I know you love making that joke, and you don't get to do it anymore. I feel bad.
And I don't know where Americans are now sending their favorite recipes, because baking at cdc.gov was a stronghold for over a decade. So I feel your pain in that, you and I both.
And it's almost Thanksgiving, and now people aren't going to know who to contact to find out what temperature to cook their turkey to. So yeah, well, we all lose, but we all win with you at FDA. So that's the trade-off. Thank you so much. You always have the ability to just like give us a lot of information and to do it quickly, but still keep it clear, and I always appreciate that. We're definitely getting some questions coming in. Keep those coming in. Obviously, I have the moderator's purview of starting wherever I like, and I'm thrilled to see that health equity is on your list of priorities, and I'm hoping we can dive into that a little bit more. The center's been a lot more visible in discussing health disparities lately. I'll just highlight a couple of things. You mentioned some of them as well. One is actually in the menthol rule. I don't know how much people like read through the guts of the rule. It's not something that we all do. And I obviously did, and I'm used to reading those. So I'm not sure people really grasp the importance of the expanded discussion of health disparities in the actual proposed rule. That's not, it's kind of uncommon, I think, because we have so much evidence on the impact of menthol. FDA could easily have gone forward just sort of presenting the information on cessation and initiation and just, kind of let that stand. And that's enough, legally to meet the standard for FDA to just get the rule through and to have it upheld in the court when it's challenged. But there was that discussion. You guys did go through this sort of expanded discussion of the impact of menthol in terms of health disparities and how that affects a bunch of subpopulations. And that was not something I had seen from the FDA before, and very, very pleased about that. And I don't think we can blame people for thinking that might be lip service after waiting for so long for the actual rule. And, I get that frustration as well. And I suspect there's people out there that are going to think within the final rule when I see it, that kind of thing. But I really think people should understand that proposed rule was unusual in a very good way. The job posting for senior science advisor for health equity, someone sent that to me as soon as they found it. Fantastic development. And if anybody on the webinar knows someone who would enjoy that position, because it sounds amazing, I wish I had a PhD. I could maybe apply. Definitely, it closes next week. You said I want to say the 16th.
Yes, the
of November.
16th. You are correct. Yes, 16th.
Yeah, absolutely fantastic opportunity. And then, really not long after you started, there was a communication that I think probably people didn't maybe even see because it was between all the e-cigarette enforcement actions. But CTP stopped using the term grandfather to apply to products that came onto the market back in 2007. And if you're not aware, calling something grandfathered in the legal context goes back to the policies that were in place to keep Black people from voting after the Civil War. So there's like racist connotation to that term, and discarding that and using something else that's better. I think all those things, on their own are just sort of little bits and pieces, but those are all moves that I'm not used to seeing this agency do. So to me, that looks like there's a definite intentional movement in a different direction. So I'm wondering, if you want to talk a little bit more about sort of how you see CTP's role in advancing health equity, in the next few years.
Yeah, no, definitely. And I appreciate you noticing all of these things because it's really part of a coordinated effort that the agency and the center have been on. I wouldn't say so much as a different direction, so much as an acceleration of the path. And I think that we've always had a strong foundation for addressing these issues, but I will say that we're at the dawn of a new era. And I think that we are in a time in society where now is better than ever to have very important dialogue and discussions around health equity that we maybe didn't have the luxury or inclination to do in the past. And so for my part, I've made health equity a front and center driver of all the decision making that we are doing at CTP. I don't think it belongs in an appendix at the back. I think it's a discussion in everything we do, from our science to our enforcement and compliance, to our health communications, to the way we engage with stakeholders. And so these few tidbits that have been occurring have definitely a long time coming and are the beginning of a lot of important work to come. And I am hopeful that once we get that senior advisor in the office of the center director, they will report directly to me. And one of my first charges to that individual will be to develop a strategic plan for our programmatic work. As I've said, we've done really great in terms of workforce health equity work at the center for several years, but I do think we need to incorporate it more strongly. And we did dip the toe in the water in terms of the language, and I'm glad folks are noticing that. And it's more to come, is what I can say about that. And I think it's critical that we continue as a broader community to keep this important work front and center. And I cannot reinforce enough how important and groundbreaking these product standards are to keep these topics front and center. Now is better than ever for us to highlight this as an opportunity for the tobacco control community, and to make sure they were highlighting the key health equity implications of the work that we have in the cooker at present.
Absolutely. Yeah, I think it is really, the timing of all of these things lines up in a really just fantastic way. I mean, I think all of us would have loved to see the FDA do the menthol rule back in 2012 or whatever it was, the TPSAC report. But the fact that it is out probably as a first product standard, and there's an administration that is putting out executive orders telling people, like, we need to think about equity and social justice in a way that the previous administrations hadn't. And so, I mean, I think it's really important in tobacco control to really think about the progress that we've made and where we've clearly failed, because the policies that we've implemented in the past, that's what created the disparities. They didn't just sort of fall out of the sky. We did policy making that led us to where we are. And we did a really great job at reducing consumption for, high wealth, high educated white people. And we really left a lot of people behind. And so, moving forward, we have to do things differently. If we just do the same thing, we're going to go in the same direction and lead to the same end. So we really have to fix the problem and do policy making differently. And I think FDA is really uniquely suited to have just a huge impact when it comes to health equity. I don't want to talk too much about the mechanics of the public health standard, and I think a lot of people who are watching this are sort of familiar with it enough. And it's in essentially everything FDA is doing in terms of tobacco control, and it has so much potential, I think, as an equity focused tool. And I'll plug, we have a publication on our website that sort of lays out what an equity-centered interpretation of the public health standard looks like. You may or may not, we're working on a citizen petition that we're going to be filing to sort of hammer down what we think that all looks like. But CTP is focused on population health, and it can really dive deep into examining how these different policies affect different parts of the population. So, I think we'll talk a lot about menthol, but I think that's an example of CTP just starting to scratch the surface. Like I said, really thinking about the disparate impact in terms of menthol. And I'm not sure that if something you guys have all talked about internally, but your thoughts would be welcome on sort of the flexibility of the public health standard as a tool to promote health equity.
Yeah, no, so I think it's a good point, and it's certainly something that's on our radar. And so for folks who may not be aware, in terms of what we've been charged with by Congress, we don't have a safe and effective standard like other centers do across FDA. So when you're dealing with a drug application, their charge is the product safe and effective. When it comes to tobacco products, our charge is the product appropriate for protection of public health? And some folks have said, well, that's clear as mud. But it's important because we do have a diverse array of landscape and also populations using these products. And so it's actually a benefit to us to ensure that we have that key public health lens that drives us, but also having the latitude to operationalize that in a key way, depending on how products are being used, how they are comprised and manufactured, and being able to apply that critical lens in a scientifically driven way. And I think that certainly includes implications around health equity and the populations that are using those products. And a key component of that is looking, and the terminology that is used as vulnerable populations and what the impact is on those populations. And that's an important component of our decisions around determining if something is appropriate for the protection of public health. And what we don't want to do is leave folks behind or otherwise differentially adverse impact one population over another. And so I can assure you that the health equity lens is certainly a component of our review of that. But one limitation that we continue to have when making these determinations is the data and the science. And ultimately, the onus is on the applicant to provide the science. And I can't reinforce that enough. We make our decisions based on the science that is provided to us by the applicants, and we make determinations based on that information. And so it's really critical that they provide the most robust science. And that includes including information around comparisons across products and information on populations that may be using these products and variations and disparities. And so in the end, we always use the science, but it's very helpful to ensure that we are provided very robust information to not only make the broader determination around, does the net benefit weigh the risks in terms of adult smokers and youth initiation, but importantly, within those groups, are there differential impacts across specific populations, which could help tip that balance depending on what the science shows.
Yeah, thank you. That made me think of sort of another dynamic to this too. So the public health standard is there when you guys are reviewing PMTAs. It's there when you're doing product standards, and you mentioned having good data. And it's always been well, I've had lots of discussions with researchers over the years, and one of the things that is particularly troubling, I think, for the folks who are in the research community who are really thinking about health equity is that, if we're doing something like the menthol rule and there is, sort of an information gap or a gap in the evidence there. I mean, there isn't with menthol. There's nothing there that probably would be considered a gap. But, just as an example, when there is sort of that evidence gap and researchers want to help fill it, but you can only, go where the funding is, unfortunately, for most folks. But CTP also funds a ton of research. So, I'm wondering how much, what part of that mechanism, is that something that you sort of wait to make part of the strategic plan, or are there moves that you'd like to see on what research CTP funds at this point already?
Yeah, absolutely. So, one thing that's important to me is definitely the science. We use it in our decision making. It's not only the science that FDA conducts, whether it be through surveillance, such as the National Youth Tobacco Survey or the PATH survey. We have a lot of internal mechanisms where we collect data, but you're also right that we do fund external entities as well. And that includes the Tobacco Centers of Regulatory Science, or the TCORs. And they actually just had a group meeting last week. And that's a key lever that we use to get data on areas that are of our priority for us. And they're renewed every a couple years to ensure that we can fund entities that are really doing the science and work that's of priority for the agency, to ensure that we've got the data and science needed to move the needle forward. So I certainly see that continuing. Of course, I'm a scientist by training. I understand the importance of it. And I also understand the importance of being nimble. And we have to stay relevant in the field of tobacco control. And there's a lot of new ways to collect data that's very meaningful and mindful. It doesn't mean that we're replacing our gold standards, but we're supplementing it with information that can allow us to be more agile, more nimble, to collect data, to make more real-time decisions to help inform our actions, as opposed to waiting to clean something on the back end after it's already occurred. And so towards that end, there's a lot of opportunity for not only TCORs, but external researchers as well, to continue to build that evidence and science and to submit it when they have the opportunity to FDA. The public comments are a key way to do that. When we do any product standard, including the menthol and flavored rules, and also this would be the case with the nicotine standard, we look to the public to submit the science and the information. And if there's something you don't like about that proposed rule, by all means, submit the science and show us that it should be done a different way to support that position. But that's what drives the work we do with the science. And so for our part, we're issuing funding where we can. I hope to continue that as strongly as we can moving forward, but also can't reinforce enough the importance of other science, including at the state and local level. Some of the states and locals that are implementing these really novel strategies that are being done, make sure you evaluate them, make sure you build the data, get the important information that could be pertinent if that was scaled up. That's how tobacco control has functioned for decades, whether it be smoke-free policies, taxation, tobacco 21, flavored policies. We've always percolated from the bottom up, but it's critical that we have that science to help drive our direction as it does scale up.
For sure. I mean, I think it would be great to see, sort of FDA taking that role of let's go out and do the evaluation of these policies that we're interested in also. I mean, I know, particularly at the local level, New York City did a great job of evaluating some of its early policies, but the smaller municipal governments, they don't really have the funding to do that evaluation, and that is absolutely something FDA could. And I know that some of that is happening. It's not as if there isn't any, but yeah, I mean the ability of FDA to sort of think about like, okay, we have this menthol rule on the horizon. Let's find out what's happening in all those little places that have done it. Probably not going to quite work with nicotine reduction, but whatever else is sort of coming along. If FDA is going to take that role, I think that would be fantastic.
Yep. No,
yeah. So okay, I want to make sure that we talk menthol, because I think it's a ton of people want to hear anything and everything you can say. So I mean, we're getting tons of questions. Obviously, I'm sure people would love to have me try to pin you down on the date of the final rule. I'm not going to do that, obviously, but I would sort of like to spend a few minutes talking about what you all might be doing and what the rest of the folks in public health can be doing as we're sort of waiting for that to happen, or preparing for the final rule. And I'll throw out a few ideas that we've talked about internally here, and things that people are asking about. And to the extent that you can, sort of, perhaps you can share what sorts of things you might be working on, or what you think, like I said, the rest of us should sort of be doing. So in our comments in the menthol rule, we highlighted a lot of information on the experience in Canada. Similar country, similar policy, a lot of reasons for that to be a legitimate comparison. We had a bunch of discussions with Jeff Fong and his team to sort of like really understand what happened with the quit rates there. And I'm sure you've seen the numbers, you know better than I would, but the cessation numbers were staggering. I mean, they're really, really fantastic. And one detail that I don't think quite ever really made it to the forefront about the Canadian experience, and it's something that I heard from Michael Chayton a while ago, is that when their federal menthol policy was being adopted, there were other tobacco control measures that were sort of taking all the attention in the media. And it was to the point where when the policy was implemented, there were a huge number of menthol smokers who were completely unaware that that policy was coming. So they found out there was a ban on menthol when they showed up to a store to buy menthol cigarettes, and there weren't any. So, I mean, when you think about that fact, and then you look at the quit rates, so that says to me that their experience, that's the floor and not the ceiling of where we could go. And it's, I think that's really encouraging. So if we're working right now, we're really putting in the work and getting the word out to current menthol smokers as people are preparing for this huge quit opportunity, the impact could be, way beyond what we saw there. Now, before I get a response from you, I want to pull in like a couple of other threads, because the idea that I'm getting at is obviously, public education and community resources. One of the, and you highlighted it, one of the significant successes at CTP has been the education campaigns. It's literally saved tons of lives. I mean, even more than some of the other stuff that you would hope that FDA's work is saving lives. So that's a huge compliment to the Office of Health Communication and Education. So CTP is really good at getting its message out, and particularly good at targeting specific subpopulations with all these different campaigns. So it feels to me like it's really well suited for this task with respect to menthol. And we can't look we can't look at the past can't look past the fact that it used to be at CDC, and they have, of course, the Tips from Former Smokers campaign, one of the most successful public health education campaigns out there at all. So it feels like there's all of these pieces that have really lined up. And I think the final piece of the puzzle is partnering with sort of community-based organizations. So we've been partnering with the African American Tobacco Control Leadership Council and the Center for Black Health and Equity for years. And I know the fearsome foursome of Val, Phil, Carol, and Del Monte. And I think organizations like that would love to jump in and lend a hand in reaching the people and the organizations who need to know what's going to happen with menthol and how they can get access to cessation resources, culturally sensitive resources too. So, we'd love to hear sort of anything that you can share about what CTP is planning, or what you're hoping the rest of us are doing to sort of coordinate better.
Yeah, absolutely. So my response to that is, absolutely on the comms and stakeholder engagement front. It's going to be critical as the rulemaking moves forward. We know that in and of itself, such a product standard would be highly impactful in terms of health benefits around cessation, but it's also a critical opportunity to provide resources to capitalize on that. That said, within the federal government, we're currently in the process of coordinating across agencies within the Department of Health and Human Services to think through best strategies to ensure that we are fully prepared and equipped to maximize the opportunity for not only messaging around the impacts and making people aware, but also ensuring we've got resources and services that people can have access to. I think we've had a bit of a toe dip on this issue with things like the HUD smoke-free public housing rule, which was coordinated along with cessation resources, but this would be at a much larger scale. That said, we can't do it alone. And it's going to take efforts at the local, state, and federal level in terms of galvanizing folks around ensuring that we leverage the strong foundation that we have around cessation in this country, particularly related to quit lines and our comms channels. But importantly, we've also got to make sure that we address the longstanding barriers and barrier-free access to the known proven cessation tools that we know work to help people quit, and making sure we're getting them in the hands of folks in an equitable manner. At that said, to make sure that we're not leaving folks behind. So I will say that it's on our radar, and we're currently ongoing with work at the federal level, and that there will be opportunities moving forward for other engagement. But in the meantime, I would definitely encourage folks to be continuing to be mindful of this opportunity that we've got as a broader tobacco control community to potentially leverage this in a way that's going to be impactful for health at multiple levels.
Yeah, I mean, I know that I'm always impressed at how CDC coordinates with, in particular, the states on tips campaigns, sort of, letting them know when things are going to be running and how to sort of piggyback on that with local campaigns. And I think we can fairly say that partnering with state and local governments is something that the FDA has an opportunity to do better on. So, I mean, sort of taking that model and really doing the outreach beforehand, and because this is to me, the communication and education stuff is so much more flexible than something like rulemaking, where there's sort of this rigid formal process. With communication education, you kind of can just do it, whenever you want to. So to me, hopefully that's something that that we can see more sort of partnerships with state and local governments as well in the future.
Yeah, no, it's absolutely well taken. And we're definitely ramping up our focus in this area. As you're well aware, I started in a state program. I worked at CDC, and I led best practices in 2014. So I certainly understand the power of state action and roles. And so I can certainly commit to continued engagement, if not expanded engagement, to ensure that we're really bringing states and locals to the table. I understand the profound role they could serve. And I do strongly believe that we've got an opportunity here. And we can't do it alone. And for my part, I'm hopeful that FDA will continue to engage with states and locals in a very meaningful way, not only in terms of communication. Lip service is one thing, but I think active, fruitful, effective engagement is an important next step from that.
Absolutely. So sort of trying to pivot to some of the questions that are coming in too. So one question, FDA is considering pulling menthol cigarettes, the most harmful product, off the market. And we see e-cigarette advocates argue that keeping other menthol tobacco products on the market is important. I've seen the same sort of argument for the very low nicotine menthol cigarettes. Or, another approach would be to sort of expand access to effective cessation, products that the FDA has approved for cessation treatments. What what are the sorts of things that you think is the most, how do we maximize the impact of sort of the proposed product standards in terms of thinking about the whole marketplace of products?
Yeah, so I do think that it's a great opportunity to maximize proven evidence-based ways of quitting. Obviously, FDA has 7 approved medications, and we know that when that's combined with counseling, it expands efficacy even further. We've also got a lot of really strong population-based tools in effect, including quit lines in all the states that we can leverage. That said, I'm certainly mindful of the discussions around the potential for people to be transitioning to other products. And so that said, we did have a public comment opportunity where we specifically asked people information to focus on key things, including cessation, the health equity component, and also science on transitioning. We're certainly mindful of discussions around the likelihood that people would transition to menthol e-cigarettes in particular. I will say that FDA fully acknowledges that if an adult smoker were to transition completely to an e-cigarette, that would be a net benefit to the individual. There's no question that e-cigarettes as a broader class are less risky than a conventional cigarette, but that doesn't mean that there's no risk. But it also doesn't mean that there's not more information that's needed on whether that product is effective at helping people quit. And that's really the end goal in terms of public health, is does the product allow people to quit completely or to significantly reduce the amount they smoke? That said, on the menthol e-cigarette issue, in terms of handling that, the FDA is tasked with reviewing individual applications on that front, and that's what we're currently doing. We did make the first decision around a menthol e-cigarette within the past couple weeks, and that was based on the available science. There's certainly other applications for menthol products in the queue, and this first decision is not a guarantee that we're going to release a marketing denial order for every menthol e-cigarette, but it's going to be based on the science, and the onus is on the applicant to demonstrate does the net benefit of that product for adult combustible smokers outweigh the risk to youth? And right now, it's a really hard standard, given that a sizable portion of youth report using these products, and in many cases, there's not a differential effect between tobacco-flavored e-cigarettes and menthol-flavored e-cigarettes. And so again, we're certainly mindful of what's going to happen elsewhere on the product landscape, but we've got to base our decisions on the science, and that's where we're going. We have received several comments on this issue in terms of public comments, and there'll be more opportunity to do that with final rules. But I do think that it's important for us to ensure that we do base all of our decisions on the science, and that's what FDA will continue to do as we evaluate the variety of flavored products out in the marketplace, including menthol.
Great, thank you. I want to make sure that we talk nicotine reduction at least a little bit before before we run out of time. I'm happy to see that in your presentation, for sure. I mean, it was discussed by FDA leadership sort of quite a bit for a while pre-COVID, and then there really hasn't been much discussion lately. And like you said, there's sort of that black box communication from the outside. It sort of feels like the FDA is not thinking about it, and I know that's not the case. So to me, I mean, I think clearly after the menthol and cigar rules, this should be CTP's absolute top priority in terms of rulemaking, at least. I think we're at a point where some communities have had such huge successes on the policies that they're working on that they're working on endgame. We're calling it endgame. The state of California has plenty of communities that are thinking about that. For example, we're seeing policies in Massachusetts, and people are talking about it in lots of other places as well. And FDA's authority with respect to tobacco products specifically prohibits from banning the sale of a class of products that are subject to the federal tax code. So endgame that we're seeing at the state level or at the local level is not something that FDA can do, obviously. But and you mentioned it, nicotine reduction feels like endgame when it comes to FDA policy. And I think that's sort of that's the closest thing FDA has to anything that you would call endgame, and it would be just such a huge leap forward in commercial tobacco control if FDA is implementing that policy. To me, I mean, I can remember like 5 or 6 years ago first seeing some really cohesive presentations about nicotine reduction. People like Dorothy Hatsukami and Neil Benowitz and Eric Donnie, the experts on that. And my initial reaction was shock at sort of how far along we were in sort of, really building up the evidence base and answering all the questions that need to be answered. There was a stretch of time for a few years where I was, constantly seeing that stuff, and they were publishing information all the time. And I remember, sort of hearing them articulate the gaps in the evidence base and then seeing people publish and filling in those gaps pretty consistently. And I, back in 2017 at the national conference in Austin, I asked Dorothy Hatsukami, do you think there's enough evidence for the FDA to move forward on nicotine reduction? And she said, absolutely yes. And I take her at her word. I don't know that anyone knows that topic any better. I haven't followed that closely recently, but I'm sure over the last few years, they're still working on building that evidence base. So it feels to me like nicotine reduction is not just this possibility, but it's maybe an inevitability. I'm hoping maybe you can expand a little bit more on nicotine reduction, where you think we stand, maybe what you think we can expect, and again, sort of what those outside of FDA can be doing to sort of keep moving things forward.
Yeah, so I will say that, as I'm sure folks are aware, there's a broad and lengthy, if not glacial, process that must be followed in terms of product standards. And so the menthol and flavored cigar is certainly further along. So first we announce our intent to propose a rule, then we propose a rule, then there's comments, then there's final rule, then there's more comments, and then there's an effective date thereafter, which is normally a year, but that can vary after the rule is finalized. That said, we're at the very preliminary stages in terms of the product standard, but I can tell you that the FDA would not announce its intent to do something unless there was strong science to support that action. And this is not necessarily a relatively new concept. We've been talking for 30 years in the field about the notion of a nicotine product standard, and the science has built over time, particularly within that last decade. We've had sizable evidence come from randomized clinical trials addressing some key questions that have always been broached in the field around: is there overcompensation when you reduce the amount? Are people smoking more? Is there greater net benefit or risk as a result of these policies? And what's the temporality of how quickly should you do it? And what's the net benefit on the back end once you do so? And that said, we've had a lot of really great studies in science that develop to the point where we do have a broader picture on this issue. So that said, it's certainly a priority for the administration. The Biden administration has added this to its unified agenda and continued to verbalize its support for this. When it's added to the agenda, that reflects that it's a priority of the administration. And so for my part, it's certainly a priority of mine to make sure we keep it moving along in the rulemaking process. So since we've announced our intent to do it, the next step in that process would be to propose a rule, assuming we have the necessary ducks in a row to do so in terms of the evidence and the science. And after that, there's an opportunity to comment. And I really encourage folks to leverage that opportunity to ensure that we are getting the science to help answer those key questions around, what is the effect on certain populations? What is that net benefit going to be? There's been a lot of great modeling studies that have suggested a very profound impact, millions of lives saved by 2100. But it's also important that we continue to address this through the rulemaking process. So I can't give you a crystal ball, but I can tell you that it's a priority of mine. And when things are a priority of mine, you can rest assured that they're going to move towards fruition.
I believe you 100%. I don't know if other folks will, but I definitely believe you. I wonder if this is something where, well, and this is nothing on you. It's just, like you said, the FDA's process is glacial. And I think people who follow FDA, the track record of saying, like, this is our top priority, we're doing it. If, just menthol as an example, I think people got a little jaded, and, I don't think we can fault them for that. So I hear you that this is a priority, and I absolutely take you at your word. I wonder if it's something where folks in public health would be maybe petitioning CTP using the same process that happened with menthol, or sort of thinking about other ways to help you all move forward, to use the carrot and the stick, perhaps.
Yeah, no, well, I just say that, we have mechanisms that we have to follow. And I'm a longtime career bureaucrat. I'm not a political appointee. I'm a career civil service. And there's certain processes that have to be followed, and they take time. And it does depend on whether those things are prioritized within a given administration. But right now, the stars are definitely aligning in terms of it's on the unified agenda. There's support from definitely FDA. But we've got to make sure that we develop content that is scientifically defensible and appropriate. And so we want to make sure we have all those ducks in a row. So certainly at present, it's full steam ahead to continue the rulemaking process. And we have announced that we intend to do it. And we're working very diligently to move forward as expeditiously as we can. But I'll just say that, it's the federal government. Everything we do gets litigated. I can tell you that I was fully aware of that coming into this position, was not foreign to me, but it's the nature of the beast. And if something doesn't happen immediately, as long as we continue to keep things moving, that's a net benefit. And that's a plus in terms of our approach of making sure we're getting things to the next step. And that's how things have worked for many years, despite all of the other things happening in the ether, including various litigation.
Yeah. No, excellent. All right. I don't want to keep you at time. This was, fantastic conversation. I could ask you questions for another, 3, 4, 10 hours. Obviously, we'll have you back for another webinar again sometime soon. But thank you so much, Brian, for making the time for us today.
Okay. Thanks so much. It's a pleasure, and appreciate the opportunity, and hope to chat with you all again soon. Bye.
Thank you. Have a great day, everyone.